Hello, dear friends. My name is Dr. Igor. I'm clinical oncologist practicing since 2010. Today we will talk about the diet, about the nutrition of cancer patients. It's not a lecture about the cancer prevention for healthy people, because cancer prevention is quite much better understood topic, I would say, because we know a lot of foods that can help to prevent cancer. We know that those people, for example, who eat a lot of vegetables, fruits, less red meat, who eat maybe Mediterranean diet, they have less risk of getting cancer. But when the patient already has cancer, the situation is totally different and much less understood, even by science, because different recommendations from different countries may have quite different opinions about it, and also what can prevent cancer, it cannot necessarily treat it. So the topic is very difficult, to be honest, and I spent quite a lot of time preparing this lecture for you to gather all the information that you may need for better understanding the situation. I won't give you the exact recommendations that you need to do this, you need to eat this, you cannot eat this. Why? First of all, my channel is based on science, and there are a lot of gaps in the science, in the nutritional sciences, and there are a lot of different researches that show totally opposite results. And also, all the patients are different. We're all different genetically. We have our own lifestyle. We have our own habits. And all the tumors are different. Even the same diagnosis we take two patients, one, for example, both have lung cancer, but all these tumors will be totally different. Even the diagnosis is the same, the stage is the same, localization, everything is the same, but they will behave totally differently. And we know only some markers of the cancer that can help us to make the prognosis how it will behave, but most of the tumor characteristics are still unknown, and we don't know how to predict the tumors. Even one patient with the diagnosis of cancer has a totally different parts of the same tumor, and they behave differently. And we find that this metastasis looks like this, the primary tumor looks different, this metastasis looks different again, so it's very difficult. That means that there is no general recommendations that can be applicable for everyone, but there are some principles. I will try to tell you a little bit about the principles. Please look. We will talk about why the nutrition is so important. I will give also you some information about the official recommendations that doctors, oncologists usually give to the patients. And also we will talk about the does really cancer love sugar, about the Warburg phenomenon, about the keto diet. Is it really a panacea? Is it really the super treatment for any type of cancer? And we will talk about whether the sugar can be actually good for cancer patients or not. And also few words about the restriction of different amino acids or vitamins in order to starve the tumor. And does really fasting starve the cancer? Let's get started. Okay, why diet is so important? The diet is the basis of everything. We know that what we eat can really cause many problems because, for example, according to World Health Organization, many of cancer cases are really preventable, and many of them are associated with the unhealthy food consumption. We know that many diseases may be caused by food, and for example, some products may aggravate gout or diabetes or the kidney stones, for example. And we actually use diet for treatment of many conditions as a part of complex treatment. And it is really necessary to choose the correct diet for every individual patient. I want to emphasize that the diet is not the replacement of treatment. It's the additional important component. We know that malnourished patients who have low weight or who have low muscle mass, they are more prone to adverse reactions during treatment. They don't survive so well the treatment of tumors. They have more risks during surgeries. That's why it's very important to assess the risk of every patient coming, and the oncologist will see his status of the patient, and if needed, he will even prescribe some additional remedies for this. For example, sipping. These are protein shakes. That's not only proteins. There are a lot of calories, a lot of vitamins, microelements there. But in small amount of shake, there is a cocktail. There is a large amount of calories and nutrients. And this is usually given in addition to the normal diet of the patient. So whether you need it or not, it's decided by your doctor. And according to the recent meta-analysis, this is the statistical analysis of many clinical trials on real cancer patients. These additional nourishing mixtures, they really help to decrease the side effects of the treatment. And because all the tumors are different, all the patients are different, depending on the localization of the tumor, depending of their nutritional status of the patient, we need to choose the individual regimen for every patient and choose what diet he should follow. We know that every day in every person, thousands of cancer cells are formed, but normal immunity, normal mechanisms of anti-cancer mechanisms, they will stop the survival of these cells or just fix the mutations. But in addition to genetics, to environmental factors, to bad habits, immunity problem is present in almost every cancer patient. That's why it's very important to work with immunity too. I was talking before about the immunomodulators during in oncology patients. I was talking about medicinal mushrooms like reishi, like chaga, that can influence the immune system. Especially we know that during chemotherapy, it affects the most fast growing cells in the body. These are tumor cells, and also immune cells are very fast dividing cells. That's why chemotherapy will affect them very much. That's why we need to support our immunity. And also we need to take the products, the food that will give all the necessary components for normal immunity work. I was talking about it in one of the videos before. And if we talk about the official recommendations, we know that the oncological process is connected to catabolism. The proteins will break down. The tumor will release the cytokines that will increase inflammation in the body. That's why we can see, for example, fever or weight loss in such patients. And the body will break down its components, its storages, to fulfill the needs, nutritional needs of the tumor. And these patients lose muscle weight, and the muscle mass, it's needed for physical activity. That is very important in struggle with cancer, in normal functioning of the body, of the immunity, and also with increased risks of adverse reactions during the therapy and worse outcomes. That's why we always monitor the protein in these patients, the albumin in the blood, and we, if necessary, we give the protein shakes. And we need to adjust the diet so it will be rich in calories, rich in nutrients. The need for protein in such patients is 1.2 to 1.5 grams per kilo per day. And the energy needs are 25 to 30 kilocalories per kilogram per day. We give a preference for the fractional nutrition 5 to 6 times a day or even more, with inclusion of vegetables and fruits. Vegetables and fruits have a lot of good things like fiber, like lots of vitamins, and they have a lot of natural anti-cancer compounds in them. We need to include unrefined grains, and limit the intake of refined carbohydrates. For example, the white rice is not very good. It's better to take brown rice because all the vitamins are in the coverings of the grains and cereals. Then, it's necessary to limit the consumption of red meat as it's considered to be the oncogen, and the red meat consumption must be 350 grams per week by the recommendations. But really, this is more for prophylaxis, but during the cancer treatment, when the patient is malnourished, he needs protein very much. I would say that this recommendation can be reconsidered. In such situation, we have a different approach. And sometimes it may be necessary to give patient a lot of meat, because meat is also rich in vitamins and micronutrients and in protein, also fat. That means in some situations, meat is totally okay for oncologic patients. And we always look how the patient individually will tolerate these or that foods. And we always need to limit the consumption of different processed meat like sausages, smoked, pickled foods, fried foods, canned foods, very salty foods. This is not good even for a healthy person. It's okay if the person eats spicy, a little bit spicy, not very much, because spices may have also anti-cancer action and they may improve the digestion. But also we must see how the person tolerates it and what's the tumor localization. More vegetables, more fruits, more grains. We shouldn't forget about the interactions between food and drugs. The classical example is grapefruit. Better not to take grapefruit for these patients, especially if they are getting some treatment. It may increase toxicities or it may reduce the effectiveness of the drugs. And we should always fight with the loss of appetite. How do we do that? First of all, more often small meals may help. Also, maybe add some lemon, something sour, maybe a little bit spicy. Try to cook tasty. It's totally okay for the patient because he's in such condition when we are not thinking about, oh, if we give him, for example, chocolate shake, oh, it's very bad for him. In 10 years, it can lead to some problem. No, we're talking about now. Now, if the patient can't eat anything and he wants chocolate shake, please give him chocolate shake so it will improve his situation, improve his nutrition, and increase his mood, of course. That is very important in the struggle with tumor. Next, doses of vitamins and minerals. They must not exceed their daily needs, and preferably they should be received from the normal food. Supplements are needed only if there is a real deficiency. If there is a deficiency of, for example, iron or B12 or folate, please give the patient, don't be afraid of taking these supplements. Otherwise, don't take any extra supplements that are not needed. About folate, I will tell you later because in some situations it's better not to take folate. We'll talk about it later. Next, if the patient has, for example, diabetes, insulin resistance, it's better to maybe limit his carbs a little bit and give him more fats, because fats are twice more effective energy source than proteins and then carbs. Even in some recommendations, they say, oh, don't give anything fat, no fats, no fatty meat. By the way, fatty fish, if the patient tolerates it well, it's a good source of different nutrients, of calories, and also of iodine. That is very important. Seafood is good in general. Also, we can always choose the meat like poultry, for example. The meat that is more easily digested. Also, I forgot to tell you to fight the bad appetite. Doctors can prescribe prednisone. It's usually a short course of 1 to 3 weeks. But the problems are increased loss of muscles, increased fat. That means gaining weight, but not because of gaining muscles and building protein. It may also aggravate the insulin resistance, and it may increase the risk of infections. Also, the other drug, for example, is megestrol or progestins. These are female hormones, and they can also increase the appetite but the problem is risk of thrombosis. By the way, omega-3 and fish oil may also help these patients. If the person has aversion to meat, please, there are other sources of protein like eggs, like beans, legumes, like milk products, cottage cheese. Also, if there is for example, nausea, vomiting, or their food is stuck in the stomach, it's not moving, then their drugs like metoclopramide may help. Their food must be cooked if the person is using chemotherapy, because if their immunity decreases, there is increased risk of infection. Better to use the temperature to kill the bacteria in the food. But if possible, if the patient tolerates well, it's better to use fresh fruits and vegetables rather than cooked ones. But it depends on the individual situation. Fruits, melons, especially watermelons, they should be taken at least 30 minutes before meal, not together with. There are some fruits and vegetables that are rich in fiber, like, for example, dates, figs, most of berries, oranges, lemons, beets, carrots, cabbage, eggplant, sweet peppers, and there are some others that contain not a lot of fibers. Watermelons, melons, zucchini, tomatoes, green onions, etc. Honey, it's a carb. We will talk later about keto diet. Of course, you can't use honey there, and many vegetables there, and many fruits there, most of fruits there, but still, honey can help in fight with different side effects of radiation therapy and chemotherapy, especially when it's connected to mucositis, the ulcers in mouth, on tongue, on gums, in all the GI tract. It may help to protect the mucus and heal it a little bit. And also it's the source of calories of carbs, but don't exceed 60 grams per day. And also honey is not very good for diabetics. As for fats, also you can use the vegetables fats like olive oil and flaxseed oil. Also, black cumin oil is quite interesting in cancer patients. I have some videos about this. They may actually protect from drops in immunity in neutrophils during chemotherapy. All the other oils are better not to use because they are more inflammatory. They have more omega-6, but these oils have a good omega-3 concentrations. Also, as a source of fats and proteins, you can use nuts, but be careful how you store them because they can easily get the mold, and mold on the products is prohibited, especially for cancer patients. Cruciferous and cabbage are very interesting family of foods, of vegetables. If you take the usual cabbage, you should better make it as small as possible so it will be easier digested more easily. If you have problems with GI tract, it's better not to eat it raw or not to eat it at all. But it's rich in fiber and it has a lot of sulforaphane that is anti-cancer and antioxidant component. Also, broccoli is very good. And by the way, 3-day sprouts of broccoli, they contain 30 to 50 times more sulforaphane than their mature broccoli plant. And if you cook broccoli, it's just a few minutes. Cauliflower, it has less fiber, but it's much better tolerated, especially for people with GI problems, with lots of gas, bloating. It has a lot of nice vitamins, vitamin A, C, group B vitamins, and it's easily digested, much easier than usual cabbage. And that's it about the general recommendations and principles. Let's go to the next interesting topic about the cancer loves sugar and about the keto diet. So if you look here, that the glucose is used as an energy source by the process of glycolysis, the degradation of glucose through pyruvate. If there is oxygen, we all breathe, or our cells get oxygen. And we get 36 up to 36 molecules of energy plus CO2. If there is no oxygen, for example, when we are training a lot, the muscles don't get enough oxygen, the needs are much higher than the supply, then we get this anaerobic glycolysis. That means no oxygen. And we get only 2 molecules of ATP and lactate. Lactic acid causes the pain after training, especially if you are not trained. There is an enzyme, pyruvate kinase, that will help the process of pyruvate degradation. And There are two types of this enzyme. M1 is in all the cells, M2 is in cancer cells, and in growing divided cells. Why? Because this is, you see, it's not effective. It doesn't give us a lot of energy, but it gives us bricks for building the new cells. That's why dividing cells and cancer cells, the cancer's goal is to grow a lot, is to divide. That's why it uses this pathway, because you can't build new cells just from energy. You need some bricks to build new cells. And by the way, there were interesting research when the researchers, they blocked M2 type and our normal cells stopped to divide. They don't get any of this pathway anymore. But cancer cells, they continued to divide and grow. That means that cancer cells, they are very highly adaptive and they can use other pathways around to reach their goal. That's why there is a lot of research now trying to understand what is the difference between cancer metabolism and normal metabolism, normal cells, so we can affect these metabolic pathways so cancer cannot get any energy and building blocks for the new cells. This is the other field of investigations nowadays. In 1925, Otto Warburg observed that cancerous cells, they take glucose much more than normal cells. And they rely on this other pathway where no oxygen is used. That's why there was the idea that if we don't give glucose, then cancer cells will die, will starve. In reality, it's not so easy. Warburg phenomenon is just one piece of the puzzle, because there is also the reverse Warburg effect when the tumor easily uses oxygen. And also some tumors, they really love fats. We'll talk about it later. Other carb is fructose. It's a very abundant component of Western diet, what most of us eat. And fructose is associated with many diseases, not only cancer. Even moderate doses of chronic fructose, if you consume them often and chronically, may lead to increased risks. For example, there were studies in rats that were getting their moderate amounts of fructose. If you count it for a person, it's like 1 cup of sweet drinks of soda a day. And they found out that there is increased risk of colon cancer in these animals. And now it's clear that cancer cells can really use fructose as a source of their energy. If we talk about sugar, it's for nowadays it's clearly associated with risks of esophageal cancer. All sugary drinks, cakes, fruits, many vegetables, they have these fast carbs that will lead to spike of insulin. And insulin and also insulin-like growth factor 1 is the important factor that will increase the growth and development of cells, meaning it will stimulate the cancer to grow and develop. That means if we eat carbs, theoretically, this will increase insulin, this factor, and it will promote the growth of cancers. Also, we know that obesity is associated with increased risk of many cancers, including prostate, pancreatic cancer, breast cancer, ovarian cancer, colon cancer, some blood malignancies. And in general, these patients may have some worse outcomes compared to normal weight individuals. By all this information I mentioned, we can think that, okay, if we give these patients less carbs, if maybe they do some starvation, if they do ketogenic diet, it may improve their weight, it will decrease their insulin-like growth factor. It won't stimulate tumors so much, so it will give us a really good benefit for health in many ways. Some people starve, some people do keto diet, for example. Keto diet is like strict limitation of carbohydrates, meaning that the body won't get enough carbs from the food and it will have to tune its metabolism to fatty metabolism. It will produce ketone bodies from fat storages and feed the organs with them. And according to the previous research, Cancer cells love sugar, they can't eat normally fats, that's why sugar is low, there is no insulin, then low insulin. That's why the cancer will starve, and this is a really good logical chain. Also, we know that ketogenic diet and calorie restriction diet, they increase the infiltration of tumors with the immune cells in mice. That means it will attract the immunity to kill the tumors. It's good. And there are some clinical trials on patients with cancer testing ketogenic diet. Unfortunately, they are very small and they did not compare patients with like ketogenic diet patients with just usual diet patients, for example, or other diet patients. They're not randomized. They're very small. And what we get from these studies is just that keto diet was tolerated very well, and there was some improvement of quality of life, and there was improvement of adverse reactions. So their treatment, chemotherapy, for example, was tolerated better. Of course, these are not the well-arranged trials, and we need bigger trials so we can understand better and maybe understand which patients would benefit from ketogenic diet and which will not. For example, maybe we should give ketogenic diet only for diabetic patients or those patients who were eating a lot of carbs all their lives, and we'll think, okay, maybe because of these carbs there was increased risk of tumor development, or maybe some tumors will have a benefit of ketogenic diet, some special tumors. And there is a recent systematic review about these investigations. By the way, there were some patients with neurological tumors, of brain tumors, some with ovarian tumors. I will leave the links below if you want to read more about it. But the information whether the ketogenic diet is very beneficial is still lacking. I really hope that there will be more good clinical trials in future. Anyway, in my opinion, if the patient has diabetes and, what I already told, was eating a lot of carbs all his life, maybe it's worth not trying ketogenic diet in these patients, but it's not official recommendations. It's just theoretical. Next, very interesting. Ketogenic diet is not for everyone. By the way, some tumors, they really love ketone bodies, they really love fats. And if you give them fats, they grow much faster. There is some information that these tumors may be located close to the fat tissue in the body. For example, if the patient has breast cancer, there is a lot of fat in breasts, and maybe it's a sarcoma from fat tissue, liposarcoma, or also diffuse large B-cell lymphoma. They may be fat-loving tumors. But again, not all of them. So it would be really ideal if we could, after taking the biopsy of the tumors from the patient, see the metabolism, study the metabolism of the tumor, to understand what this tumor, what it prefers, so what's better to choose for this patient. But for now, it's not applicable, unfortunately, in the real life. Now, about their amino acid restrictions, in order to attempt to starve the tumors. There were different attempts to do that. For example, to starve with glutamine, to starve with methionine, because these tumors, they really need much more of these amino acids than normal cells. That means if we don't give them these amino acids, the tumor must maybe not die, but at least stop growing. But in reality, it's very difficult to follow these diets because in most of the products there are enough amino acids to still supply the tumor, and you need especially produced products that will be lacking these amino acids. But there is some other nice approach when we give their enzymes that will destroy these amino acids in the body. For example, some blood cancers like lymphomas or acute lymphoblastic leukemia, they may be treated with asparaginase. This is the enzyme which will destroy asparagine. That is amino acid necessary for these tumors. And it really improves their outcomes in these patients. Also, some tumors are dependent on arginine. For example, this is liver cancer, this is melanoma, and this is pancreatic cancer. but still we don't have effective drugs to aim this spot in tumor metabolism. Next, we know that folates may be used by some tumors, especially if we are talking about acute lymphoblastic lymphoma, ALL. And we can use the methotrexate that will block folate, and it will stop the tumor. So, as you see, there are already some drugs that can be used to aim metabolism of the tumors, but still more research is needed. And in this case, of course, it's not very good to take the folate supplements. Next, fasting. Fasting is a very interesting topic. You can see sometimes some videos in YouTube, for example, that will say, oh, there is a patient, he was doing fasting and he healed his cancer. First of all, we don't know what healed his cancer, because it may be placebo if he has a strong faith. It can be maybe he's taking some other herbs, maybe something else in combinations. We don't know what helped him, because sometimes we see the really interesting situations when the cancer is gone itself, or it's gone after the chemotherapy, even the most aggressive cancer that is never gone, but here, and it's gone. And we don't know actually what's going on. Maybe this is the tumor type, some individual properties of this tumor. Maybe this is properties of this human, his immunity. There are many factors that we can't predict for now. But in most cases, the fasting doesn't heal the cancer. And in some patients, fasting may be very dangerous, because if they are already in a malnourished situation and he will fast, he'll be even more malnourished. The cancer will take their last from the body, but the body will be starving a lot. But anyway, most of the studies found that their fasting may help to improve their effectivity of chemotherapy, radiation therapy in animals. And by the way, we have some trials on humans with cancer. For example, they're small trials, and mostly what we get from there is that starvation may help with adverse reactions and improve the quality of life. Meaning that starving for 24 hours before chemotherapy and 24 hours after chemotherapy may decrease the, for example, nausea, vomiting, weakness, and the patients tolerate it better. Maybe because autophagy is activated, that's why their usual cells won't get so much chemo drug, and the cancer cells will get more. There were some other studies that showed similar results. 36 hours before, 24 hours after chemotherapy also helped these patients. But they never researched the effectiveness of chemotherapy in these cases, whether fasting improved the effectiveness or not. That's why these studies are not enough to do any conclusions. Of course, this topic is very interesting, and for me it would be very interesting to know, does starving really help these patients, and what patients should be prescribed starving maybe. But in standard care, it's considered to be unethical not to feed the patient. That's why, and we don't know if it's really helping or not. That's why it's not standard for now. By the way, there is the systematic review on animals, on mice with cancer, who did ketogenic diet, who did their calorie-restricted diet and intermittent fasting. And they found that there was improved tolerability of treatment in those having ketogenic diet and those having their calorie restriction. But for intermittent fasting, there was not enough data to do any conclusions. But it's on mice. We still need more investigations on patients. Dear friends, in general, one of the best diets for today is considered to be a Mediterranean diet. And mainly because of its plant-based components, and because they have a lot of nutrients, vitamins, fiber, they have a lot of anti-cancer phytochemicals inside. Also, seafood is considered to be very good. And by the way, Mediterranean diet is considered to be very good for other conditions like high blood pressure, like diabetes. And nutrition should be chosen individually, depending on the patient characteristics, on his diseases that he has, on the localization of tumor, of the tumor type, on the treatment he's getting at this point of time, on the situation with his gastrointestinal tract, on his tolerability of these and that products. In general, cruciferous vegetables may be very good. Linseed, flaxseed oil, their olive oil, iodine is very important, omega-3 is very important. Always check your vitamin D levels, maybe vitamin D supplementation may be needed. Don't forget about the food for the immunity, and don't forget about medicinal mushrooms. Always talk to your doctor, maybe consider the ketogenic diet in your situation. I know that it was a lot of information, and I'm sorry you did not get very precise steps, but I hope you got a lot of information to think about and to discuss with your medical professional. I wish you be healthy. I wish you have a good mood. My name is Dr. Igor Atabekov. Bye-bye.